The third thing on your list, look for how quote unquote diagnosable issues are connected and help the client understand.
Yeah. So it's not uncommon for a client to start therapy and to say, I've been diagnosed with this and this and this and this, and have their like CVS
I'm
receipt.
collecting pages in the DSM-5 like fucking Pokemon cards. Gotta catch them all.
But it's really common. And sometimes those things feel good to have a name. Sometimes it feels really shameful to come in with a whole list of things. And so, keep in mind that all of those things are separate because of the way that insurance works, but that you're sitting in front of a person with a single brain and a single body, and all of those things are connected. So, for instance, anxiety and depression are almost always the result of other things that are going on in their life, that they didn't magically appear on their own. They're a result of, maybe they're tied to having masked ADHD all of their life, or maybe it's tied to like the environment that they grew up in.
Oh my God,
or,
can you imagine if anxiety and depression just like struck at random? No, there's a reason why you're experiencing those things.
Yeah.
You don't just have those things.
Absolutely.
There's symptoms.
And even when there's a genetic component to something, I know a lot of people will talk about like depression can just be genetic. There are circumstances that make that more likely to occur than not. So even if something like seems to run in your family, one, there's a good chance that your family has dealt with something the same way for a long time, and you're kind of carrying that like family burden of we don't talk about stuff, or we don't whatever.
Like Bruno.
Yeah, we don't talk about Bruno.
Right.
But
I love that. I love that song. I'm sorry.
but there are situations that make it more likely that even those genetic things will occur.
I think that some people find some like solace or even pride in their diagnoses.
Mm-hmm.
Diagnostics.
Uh-huh.
And like, this is a podcast about therapy, and I'm not sure what that word is. Way to go. What was I saying? So they...
Sometimes people feel proud of those
Yeah.
things.
And they take comfort in them, because it's like, oh, finally I have an understanding of who I am.
Mm-hmm.
Remember that a lot of these diagnoses were established so that therapists could accurately bill insurance.
Mm-hmm.
That is why they exist. This whole system is based on a therapist being able to bill insurance. That's not evil inherently. It's just an important, like, fundamental thing you need to understand when we talk about like the diagnosing of like mental illness or neurodivergences or whatever.
Yeah.
Like, for a little bit now, you've kind of privately theorized to me that you are suspecting that traits of bipolar disorder are very similar to traits related to ADHD. Mm-hmm. That you're so hyper and so energetic for so long that you fall into a depression because your body can't sustain that, and then when you come out of it, you come bursting out because you're full of energy now, and you come bursting out of a depression with that like manic ADHD related energy. Mm-hmm. And a lot of people with bipolar have also been diagnosed with ADHD, and you and I don't think you're really trying to come out and like tell the world how they're diagnosed, like how diagnostics should work, but you are saying, I see a huge overlap between these two things, and you're less interested in like labeling them and more interested in just helping your clients like navigate a decent life for themselves.
I think the message here, especially for therapists starting out, is that it can be really intimidating to have a client come in with a long like grocery list of all the diagnoses that they have. Certainly it was for me early on. I was like, oh, somebody who is an actual professional and I'm just new, I'm just making this up as I go. They, have given this person all of these diagnoses. And sure, there can be comfort in that. It is so relieving for some people to have a name to the things that they've been dealing with. And that's great.
Totally fair.
But don't feel intimidated by that. Remember that you're dealing with a person who has one brain and one body who are deeply intertwined and connected, and that everything that happens in the one space is happening everywhere. It impacts every bit of them, and that it's so common to have co-occurring things because things are related. You're dealing with one single human.
how does that mindset kind of like tangibly play out with your client interactions?
One is that when a client comes in with a lot of shame about having a lot of diagnoses, I can help explain how things are related, that you're one person and that these things are related. So you're telling me a list of things that are going on, and I'm hearing one or two things that are interconnected. And so, like, don't worry, this isn't overwhelming to me. Like, I know where to start with this.
Yeah.
That's one way that it plays out. And when a client comes in with a long list and they feel good about that, it feels helpful to them to have all these really distinguished, different things going on. I know that I don't need to correct that.
Yeah.
I can, once again, like, get curious about what these things mean to them, where they come from. I'm sure that it's a good description of all of the symptoms that they're dealing with. And that's a great place to start. That's super helpful for me to know, okay, so you're dealing with these symptoms from this and these symptoms from this and these symptoms from this. So I just never feel like I, once again, have to come in and be the expert in somebody else's life. They're the expert in their life. And if these are the things that are happening, that's great. And it's especially freeing to not work with insurance, because otherwise in the first session I'd have to say, yep, this list of this, and this are the things that we're billing for. And getting to work with self-pay, I get to say, we can take our time with this and figure out what's going on. And if it helps you to have a name, we'll get there.
Yeah. Insurance companies demand a diagnosis
right away,
and they won't approve specific types of treatment or specific types of medication for the different types of diagnoses. Mm-hmm. And the people who are making the decisions over those companies are not necessarily mental health professionals. This is a financial business. Yeah. No, I think it's a really good point, and it's really helped me kind of accept myself a little bit, because I have, we've talked about it a lot, I have ADHD, I have bipolar disorder, I struggle with anxiety and depression. Mm-hmm. Those are all kind of the same thing.
Yeah.
That's all kind of one bucket, one individual. His name is Price. Hi. I'm a marriage therapist.
Yeah, exactly. That's now a list of 4 things. That feels like a lot. But to get to go, the outcome of you having undiagnosed ADHD for so long that was uncontrollable, that starts to look a lot like the bipolar symptoms that you have. And even though, like, we've said for a long time in the field that these are very separate things, I'm seeing again and again and again that folks with bipolar almost always also have ADHD or end up learning that about themselves. Maybe not. I'm sure that there are exceptions to this rule. Nothing applies to everybody. But I don't think it's strange to have things related. And so for you to get to go, oh yeah, it makes sense that when I have, periods of that like hyper focus with ADHD, that starts to really run into like that hypomanic territory. Yeah. And then I always have a crash from that, and that ends up to look very depressed. And that now you have one thing. Now you have one thing that you're dealing with.
It's me.
It's you.
Surprise, motherfuckers.